everybody, Dr. Chloe here, along with Carol Bear. Carol Bear is going to be my little assistant for any lactation-related specific videos. So if you click on this to watch and you see Carol Bear, know that it's going to be about lactation-specific, breastfeeding, etc., etc. I just wanted to spend a couple minutes chit-chatting about how the world of breastfeeding, lactation, nursing, bottle feeding, feeding a baby in general, it's a very information-heavy world. Luckily, with social media and things at our fingertips, it is putting a lot of these topics in front of people's faces a little bit more, but that also means that there's a lot of misinformation at people's fingertips as well. So my hope is that patients I see, or patients of CCs, or anybody wanting to be a patient, please just know that I am here to help disseminate some of the misinformation, myths, to help you kind of navigate what are the tried and true facts related to lactation and successful breastfeeding. Some people might be wondering, when should you start learning about this? And that's really up to you. It's patient dependent. Some people like to learn really early on in their pregnancy. Some people like to learn and talk about the tools and things and equipment that might make it a little bit easier before like a baby shower or something, so they know what to register for. But I would say a lot of the nitty-gritty information, it's really helpful once you're in that third trimester, kind of when all that stuff is really like, okay, it's almost go time. Like, what do I really need to know at this point? Same thing for as soon as baby is born. That first kind of few days to a week to 2 weeks can be very information heavy. So that's also a great time to ask a lot of questions. There's really no magic timeline for when you need or when you should seek out any sort of lactation care provider's opinion. However, it can be helpful to kind of establish a baseline sooner rather than later, especially if breastfeeding is your goal. So I'm hoping going forward, I'm able to encourage patients like, let's try to get something set up in that first week postpartum. And granted, I know that there's a lot of variable factors in that. Not everybody's ready to get out of the house. Not everybody's ready for that. So stay tuned. Down the pipeline, there might be some exciting changes coming, just in terms of different types of appointments that I with CCs might be able to offer, but more to come on that in the future. Of course, ideally, I'd love to get families here in my treatment room, face to face. We can work through some things together. But like I said, even if you're 3 months postpartum and you're wondering, can this be better? What's going on here? Come on in. So I think that's all I wanted to talk about right now, kind of keep it short and sweet. I'm gonna try to do a few more sort of breakout core conversations with Carol Bear, of course. I just think she's cute. So she'll be my little cue of, oh, we're talking about lactation today, versus if it's a more pelvic floor specific or a more musculoskeletal specific topic, you won't see Carol Bear. All right, let me know if you have breastfeeding, lactation related questions. I would love to help everybody and anybody troubleshoot what's going on. Bye.